Good morning, everyone. Dr. James Whittaker here. And today we're going to talk about something that's becoming increasingly common among my patients over 60, cannabis use for health purposes. Now, before you click away thinking this isn't relevant to you, let me tell you that just last week, three different patients in their 70s asked me about using marijuana for chronic pain, sleep issues, and anxiety. This conversation is happening whether we're comfortable with it or not, and as your doctor, I'd rather give you evidence-based information than have you navigate this alone or get advice from questionable sources. What I'm about to share might surprise you, especially the part about why smoking joints, the method most people think of first, is actually the worst option for seniors. Before we dive into the details, if you're new to this channel, welcome. I'm a board-certified physician who spent over 2 decades helping people optimize their health, and I create these videos to give you honest, practical information that you can actually use. If you find value in what we discussed today, please hit that subscribe button and turn on notifications. Now let's address the elephant in the room immediately. Cannabis is legal for medical use in many states and countries, and increasingly legal for recreational use as well. The stigma that existed for decades is rapidly fading as research reveals legitimate medical applications. But here's what concerns me as a physician. Most of the information seniors receive about cannabis comes from either overly enthusiastic advocates who claim it cures everything, or from outdated sources that treat all cannabis use as dangerous drug abuse. Neither extreme serves you well. What you need is balanced, evidence-based guidance about what actually works, what the risks are, and most importantly for today's discussion, what delivery methods make sense for older adults and which ones you should absolutely avoid. Let me be crystal clear from the start. I do not recommend that seniors smoke joints, and by the end of this video, you'll understand exactly why. But that doesn't mean cannabis has no place in senior health management. It means we need to be smarter about how it's used. Let me know in the comments below what country or state you're watching from and whether cannabis is legal where you live. I'm always fascinated to see how different regions are handling this issue, and your comments help me understand what information you need most. Now let's start with the basics because I find that many of my senior patients have significant misconceptions about what cannabis actually is and how it works in the body. Cannabis contains over 100 different chemical compounds called cannabinoids. The two most important ones you need to know about are THC and CBD. THC, or tetrahydrocannabinol, is the compound that produces the psychoactive effects, the high that people associate with marijuana. It also has legitimate medical properties including pain relief, appetite stimulation, and nausea reduction. CBD, or cannabidiol, does not produce a high but has anti-inflammatory, anti-anxiety, and pain-relieving properties that are being extensively researched. Understanding this distinction is crucial because the effects and risks of cannabis use depend heavily on the ratio of THC to CBD and the total amounts of each. Your body actually has an endocannabinoid system, a complex network of receptors throughout your brain, organs, and tissues that respond to cannabinoids. This system plays roles in regulating pain, mood, appetite, sleep, and immune function. This is why cannabis can have such wide-ranging effects, both therapeutic and adverse. Now here's where we need to get specific about seniors. Just last month, a 68-year-old patient named Robert came to see me. He'd been suffering from chronic lower back pain for years, tried multiple medications with limited success and concerning side effects, and finally decided to try cannabis after a friend recommended it. But Robert made a critical mistake that I see often. He went to a dispensary, bought some joints, and started smoking them before bed for pain relief. Within 2 weeks, he developed a persistent cough. His chronic obstructive pulmonary disease worsened significantly, and he ended up in my office wheezing and frustrated. This is exactly why I don't recommend smoking for seniors, and why I'm making this video today. Let's talk about why smoking joints is particularly problematic for older adults. First and most obviously, smoking anything introduces harmful combustion products into your lungs. When you burn plant material, whether it's tobacco or cannabis, you create tar, carbon monoxide, and numerous other toxic compounds. Your lungs at 60, 70, or 80 are not the lungs you had at 20. Decades of environmental exposure, possible smoking history, and natural aging have reduced your lung capacity and resilience. Adding smoke exposure on top of that is simply not wise. Many seniors already have some degree of chronic obstructive pulmonary disease, asthma, or reduced lung function, even if they've never smoked cigarettes. Cannabis smoke will worsen these conditions. Second, smoking provides very inconsistent dosing, which is particularly problematic for seniors. When you smoke, the amount of THC and CBD you actually absorb varies enormously depending on how deeply you inhale, how long you hold it, how much of the joint you consume, and the specific potency of that particular plant material. This inconsistency makes it nearly impossible to find a reliable, repeatable dose that provides benefits without excessive side effects. For seniors, many of whom are already taking multiple medications, this unpredictability is dangerous. You need to know exactly what dose you're getting so you can avoid interactions and excessive effects. Third, the rapid onset from smoking, while sometimes presented as a benefit, is actually a problem for most senior users. When you smoke cannabis, THC reaches your brain within minutes, producing effects that peak quickly. For someone inexperienced or using a high-potency product, this rapid onset can cause acute anxiety, paranoia, disorientation, and cardiovascular stress. I've had patients describe terrifying experiences where they felt completely out of control within minutes of smoking. This rapid, intense effect is the opposite of what most seniors need for managing chronic conditions like pain, sleep problems, or anxiety. You want gentle, sustained relief, not a roller coaster. Fourth, and this is crucial, smoking impairs your ability to function safely much more dramatically than other methods. The rapid, high-peak concentration means your coordination, judgment, and reaction time are significantly impaired right when the effects hit. This increases fall risk enormously, which for seniors can mean fractures, head injuries, and serious complications. Finally, smoking simply isn't necessary. There are far better delivery methods that provide the therapeutic benefits without the lung damage, dosing inconsistency, rapid onset problems, and safety concerns. So if I don't recommend smoking, what do I recommend? Let me walk you through the options that actually make sense for seniors, starting with the methods I discuss most often with my patients. The first option, and often my top recommendation for seniors new to cannabis, is CBD oil taken sublingually, meaning under the tongue. High-quality CBD oil contains little to no THC, so you get anti-inflammatory and anti-anxiety benefits without psychoactive effects or legal concerns, even in areas where THC remains restricted. You place drops under your tongue, hold for 60 to 90 seconds to allow absorption through the mucous membranes, then swallow. This method provides relatively quick onset, usually within 15 to 30 minutes, with effects lasting several hours. Most importantly, it's easy to dose precisely. You start with a very low dose, perhaps 5 to 10 milligrams of CBD once or twice daily, and gradually increase over weeks until you find the minimum effective dose for your symptoms. This gradual titration is exactly what seniors need. Robert, the patient I mentioned earlier, eventually switched to CBD oil after his smoking experiment went poorly. We started him on 10 milligrams twice daily, gradually increased to 25 milligrams twice daily over a month, and he found significant relief from his chronic back pain without any psychoactive effects or respiratory problems. He could function normally, drive safely, and experience consistent, predictable relief. That's the goal. The second option I discuss with patients is low-dose THC edibles, but only for specific situations and with very careful guidance. Edibles are cannabis-infused foods or capsules that you swallow. They're metabolized through your digestive system and liver, which means onset is much slower, typically 1 to 2 hours, but effects last much longer, often 6 to 8 hours. This slow onset and long duration make edibles potentially useful for conditions like chronic pain or sleep problems, where sustained effect is desirable. However, edibles require even more caution than CBD oil. Because of the delayed onset, inexperienced users often make the critical mistake of taking more before the first dose kicks in, then experience overwhelming effects hours later when everything hits at once. For seniors, I never recommend starting with edibles. If we eventually decide edibles might be appropriate, we start with an extraordinarily low dose, perhaps 2.5 milligrams of THC, taken at the same time each day, and we wait at least a week before considering any increase. We also establish clear rules. Take it at home in a safe environment, never take more on the same day, even if you don't feel effects yet, and have a trusted person available. The third option, and one that's gaining popularity, is topical cannabis products. These are creams, balms, or patches applied directly to the skin over painful areas. Topicals are absorbed locally and generally don't produce systemic effects or psychoactive experiences. They can be useful for localized arthritis pain, muscle soreness, or inflammatory skin conditions. The advantage of topicals is that they're extremely safe with virtually no risk of cognitive impairment, drug interactions, or systemic side effects. The disadvantage is that they only work for localized surface problems. They won't help with deep internal pain, sleep issues, or anxiety. For many seniors with arthritis in hands or knees, topicals can be a reasonable option to try with minimal risk. The fourth option is vaporizing, which is different from smoking and significantly less harmful to lungs. Vaporizers heat cannabis to a temperature that releases the active compounds as a vapor without burning the plant material, thus avoiding most of the toxic combustion products that make smoking so harmful. If someone is determined to inhale cannabis because they want faster onset than edibles provide, vaporizing is far superior to smoking. However, it still involves inhalation, still provides inconsistent dosing compared to oils or edibles, and still carries risks of acute impairment. I generally don't recommend it as a first choice for seniors, but it's exponentially better than smoking joints if inhalation is insisted upon. Now let's talk about what conditions cannabis might actually help with in seniors, because this is where evidence-based medicine becomes crucial. The strongest evidence supports cannabis use for chronic pain, particularly neuropathic pain that doesn't respond well to conventional treatments. Multiple studies show that cannabis can reduce pain intensity and improve quality of life in patients with conditions like diabetic neuropathy, post-surgical pain, and cancer-related pain. For seniors who've tried standard pain medications with poor results or intolerable side effects, cannabis can be a reasonable option to discuss with your doctor. The second condition with good evidence is chemotherapy-related nausea and vomiting. Cannabis, particularly THC, is remarkably effective for this specific problem. For seniors undergoing cancer treatment, cannabis can sometimes allow them to maintain nutrition and quality of life when nothing else works. Third, there's emerging evidence for sleep problems, though the research here is more mixed. Some studies suggest cannabis can help with sleep onset and maintenance, while others show potential for tolerance and rebound insomnia. If you're considering cannabis for sleep, CBD alone should be tried first, and THC should only be considered if CBD doesn't help and you've exhausted other evidence-based sleep interventions. Fourth, anxiety and PTSD show some promise, though again the evidence is mixed and the risk-benefit calculation depends heavily on the individual. High THC products can actually worsen anxiety in some people, while CBD shows more consistent anti-anxiety effects without this risk. Let me tell you about another patient, a 72-year-old woman named Dorothy who came to see me last year. She'd been suffering from severe anxiety for decades, tried multiple medications with poor tolerance, and was becoming increasingly homebound. After extensive discussion, we decided to try CBD oil, starting at a very low dose. Over 3 months, we gradually found her optimal dose of 30 milligrams twice daily. Dorothy reported significant reduction in her baseline anxiety, better sleep, improved ability to engage socially, and no side effects whatsoever. She'd been skeptical initially, worried about getting high or doing something illegal or dangerous, but CBD provided genuine relief without any of those concerns. That's the kind of outcome I love to see. Now, and this is absolutely critical, let's talk about what cannabis won't do and why unrealistic expectations are dangerous. Cannabis is not a cure for anything. It's a symptom management tool, just like any other medication. If someone tells you cannabis will cure your cancer, reverse your dementia, or eliminate your diabetes, they're either misinformed or lying to you. Run away from those claims. Cannabis also isn't risk-free, and seniors face specific risks that younger users don't. First, drug interactions are a major concern. Cannabis, particularly THC, is metabolized by the same liver enzymes that process many common medications, including blood thinners, sedatives, and certain blood pressure medications. These interactions can make your other medications more or less effective and increase side effects. This is why you must discuss cannabis use with your doctor and pharmacist, even if it's legal where you live. Never start cannabis without telling your healthcare providers. Second, cognitive effects are more pronounced in older adults. THC can cause confusion, memory problems, and impaired judgment that are more severe and last longer in seniors than in younger people. For someone with any degree of cognitive impairment or early dementia, THC products can worsen confusion significantly. Third, cardiovascular effects are concerning for seniors. THC can increase heart rate and blood pressure acutely, which is particularly risky if you have existing heart disease, which many seniors do. There have been documented cases of heart attacks triggered by cannabis use in older adults with cardiovascular disease. This doesn't mean cannabis is automatically off limits if you have heart disease, but it means the decision requires very careful medical evaluation. Fourth, balance and coordination are impaired by THC, increasing fall risk substantially. Falls are already a major cause of injury, disability, and death in seniors. Adding a substance that impairs balance is simply not worth the risk for many people. This is why I emphasize that if cannabis is used, it should be the lowest effective dose, taken at times when you will be safely at home, and ideally using CBD-dominant products that don't impair function. Finally, there's the issue of dependence and withdrawal. While cannabis isn't addictive in the way opioids are, regular heavy use can lead to psychological dependence and withdrawal symptoms including irritability, sleep problems, and anxiety when stopped. Seniors are not immune to this, and I've had patients who developed problematic cannabis use patterns, using increasing amounts and experiencing negative effects on their daily functioning. So how do you approach this safely if you're considering cannabis? First and most importantly, talk to your doctor. I cannot stress this enough. Even if cannabis is legal where you live, even if you think your doctor will disapprove, you absolutely must have this conversation. Your doctor needs to know about cannabis use to manage your other medications safely, to monitor for interactions and side effects, and to help you make informed decisions. If your doctor is completely opposed to any discussion of cannabis, unwilling to consider evidence, or dismissive of your concerns, that might be a sign you need a different doctor. But most physicians today are willing to have thoughtful, evidence-based conversations about cannabis as one potential tool among many. Second, start low and go slow. This is the cardinal rule for seniors using cannabis. Whatever product you choose, start with the absolute lowest dose available, use it consistently for at least a week, and only increase gradually if needed and if you're tolerating it well. Patience is crucial. Many seniors run into trouble because they start with too high a dose, experience adverse effects, and conclude cannabis isn't for them when actually they just needed to start lower. Third, choose reputable sources for products. In areas where cannabis is legal, purchase only from licensed dispensaries that test their products and can tell you exactly what's in them. Avoid random CBD oils from gas stations or unlicensed sources. Quality and safety vary enormously, and seniors cannot afford to gamble on contaminated or mislabeled products. Fourth, never use cannabis and then drive, operate machinery, or do anything requiring full coordination and judgment. Treat it exactly like prescription pain medication or sedatives. The effects impair your ability to function safely even if you don't feel particularly high. Finally, track your response systematically. Keep a simple log of when you take cannabis, what dose, what form, and what effects you notice, both beneficial and adverse. This information is invaluable for fine-tuning your approach and discussing with your doctor. Now, I want to circle back to the central message of this video. Why don't I recommend that seniors smoke joints? Because smoking is the least safe, least consistent, least controllable method of cannabis use. It damages your lungs, delivers unpredictable doses, impairs function acutely, and provides no advantages over safer alternatives. Everything cannabis smoking can do for symptom relief can be achieved better with CBD oil, carefully dosed edibles, topicals, or at worst vaporizing. There is simply no good medical reason for a senior to smoke joints. If you're currently smoking cannabis, please consider switching to a safer method. Talk to your doctor about alternatives. If you're thinking about trying cannabis and your first thought was smoking, because that's what you've heard about, now you know better. Start with CBD oil, work with your doctor, go slowly, and you'll have a much safer and more beneficial experience. Let me share one final patient story. Gerald was a 76-year-old man with severe peripheral neuropathy, causing burning pain in his feet that kept him awake at night. He'd tried multiple medications, including gabapentin, pregabalin, and duloxetine with poor results and intolerable side effects. Out of desperation, he'd started smoking marijuana joints at night. It helped his pain somewhat, but he developed a terrible cough, his wife hated the smell, and he felt foggy the next morning. When Gerald came to see me, we had a long conversation about safer options. We transitioned him to a CBD-dominant tincture with a small amount of THC, taken an hour before bed. We started at a very low dose and gradually increased over 6 weeks until we found the right level. At his optimal dose, Gerald's pain decreased significantly, his sleep improved dramatically, his cough resolved completely, and he had no morning grogginess. His wife was happier, his quality of life improved, and we accomplished all of this with a far safer approach than smoking. That's the power of using cannabis intelligently, with medical guidance, proper dosing, and safe delivery methods. Before we wrap up, I want to address one more thing. Some, you watching this might be thinking, cannabis is still federally illegal in the United States or completely illegal in my country, so none of this applies to me. Here's what I'll say about that. First, I'm not encouraging anyone to break the law. This video is educational information about medical cannabis where it's legal. Second, laws are changing rapidly. More jurisdictions are legalizing medical and even recreational cannabis every year. Understanding the evidence now prepares you for informed decisions if and when your area changes its laws. Third, CBD derived from hemp is legal federally in the United States, and in many countries even where THC remains illegal. High-quality CBD products are accessible to many seniors who could benefit from them right now, legally, without any THC or psychoactive effects. If you've been suffering from chronic pain, sleep problems, or anxiety, and haven't found adequate relief from conventional treatments, CBD is worth discussing with your doctor, even in areas where THC remains prohibited. So let me summarize the key points. Cannabis, particularly CBD, has legitimate medical applications for certain conditions common in seniors, including chronic pain, nausea, and possibly anxiety and sleep problems. However, smoking joints is the worst possible delivery method for seniors because of lung damage, inconsistent dosing, rapid impairment, and safety concerns. Far better options include CBD oil taken sublingually, carefully dosed edibles, topical products, or vaporizing if inhalation is strongly preferred. Starting with very low doses and increasing gradually is essential for seniors. Medical supervision is crucial because of interaction risks and the need for monitoring. Cannabis is not risk-free, not a cure-all, and not appropriate for everyone. And most importantly, everything must be individualized to your specific situation, your health conditions, your other medications, and your goals. There is no one-size-fits-all approach. If you take away one message from this video, let it be this. If you're considering cannabis for health purposes, approach it as medicine, not recreation. Work with a knowledgeable healthcare provider. Start low, go slow, choose safe delivery methods, and never smoke joints. I want to hear from you in the comments. Are you currently using cannabis for health purposes? What form are you using, and what's been your experience? Have you tried smoking versus other methods? What questions do you have that I didn't address? Your comments and questions help me create content that serves you better. If you found this information valuable, please hit that like button so more seniors can find this evidence-based guidance. Subscribe to the channel and turn on notifications because next week I'm going to discuss another controversial topic that seniors ask me about constantly. Whether supplements actually work or whether you're wasting your money. That's a video you definitely don't want to miss. I'll also be covering the specific supplements that have strong evidence for seniors versus the ones that are pure marketing hype. Finally, check out my playlist on medication management for seniors. There are several videos there about safely navigating multiple medications, avoiding dangerous drug interactions, and knowing when medications are causing more harm than good. As always, the information in this video is for educational purposes only and should not replace individualized medical advice from your own healthcare provider. Every person's situation is unique, and decisions about cannabis use must be made in consultation with a doctor who knows your complete medical history. Thank you for watching. Thank you for trusting me with this sensitive topic, and I'll see you in the next video where we continue exploring evidence-based strategies for optimizing health in your later years. Remember, aging doesn't mean accepting suffering or poor quality of life. It means being smart, being informed, working with good healthcare providers, and using all the tools available to you safely and effectively. Cannabis can be one of those tools for some people, but only if used intelligently. Take care, stay informed, and never stop advocating for your health.